Good morning and welcome to today's webinar on the importance and need for customized assistive devices for individual with Duchenne Muscular Dystrophy, organized by Bharat MD Foundation. We are honored to have Dr. Sama RAJU, PT, MPT, MSK and Sports as our speaker today. Dr. RAJU is an assistive technology professional certified by RESNA, USA. He is WHO WSTP courses participant and an ISWP certified trainer. Dr. Raju serves as the head of the branch and associative general manager at Mobility India Hyderabad, MIH, a disability rehabilitation and assistive technology center. Telangana, India. Dr. Raju is comfortable communicating in English, Hindi, Kannada, and Telugu. So you can ask your questions in any one language and he will answer in that. Mrs. Sneha Kamath and many other families have benefited from Dr. Raju's guidance and support since their child Sarthak was a kid. Today, Dr. Raju will be sharing his expertise on the importance and need for customized assistive devices for individual with Duchenne muscular dystrophy. Without, so I, Sneha ma'am, can you say some words about Dr. Raju, please? Name is hello.
I think
Yeah, please.
Are you
Sneha,
able to hear me?
yes,
Yes.
of course, very clear.
Yes, ma'am.
Raju sir, I am very happy to talk about you.
Thank you.
Yeah. Good morning, everybody, and wish you a happy Navratri. I am very happy to talk about Raju. Raju is, everybody knows Raju in our family. First, when we needed assistive device, we went to Mobility India about more than 20 years back. And there, the person who really used to help us was Raju. Sarthak always wanted to go back to school because he didn't want to miss classes. So Raju used to ask everybody to finish things fast. As we know, when we go to Mobility India, we can't request for preference because most of the patients have one need or other. So because of Sarthak, we requested Raju. And Raju has given good solutions to everything. Any questions we ask, he is to answer patiently. And as you know, my son Sarthak was very inquisitive. So whatever he asks, Raju is to nicely answer him and guide him and all. When Raju moved to Hyderabad, we were very unhappy. You know how to contact him, but even now we contact him through WhatsApp and this one. You Hyderabad people are lucky Raju is there because he will guide you in anything. And for me, even for my son to do MBBS, Raju, Mobility India, and their staff was responsible because we had a wheelchair, and for that they modified a board and gave. So Sarthak could keep heavy books on that, and he had to wear A4 splints. He used to wear in the daytime, so that also helped him. And he's able to keep his legs straight because of that. Then, because of all these devices, I feel my son could easily do MBBS, MD, and all. So, thanks to Raju. Raju, you please go on guiding everybody like this. We are very happy. I'm very happy to see you today. Thank you.
Yes. Thank you
Thank
so
you,
much.
Sneha ma'am. Thank you, Sneha ma'am, for your good words. So let's start the webinar. Thank you. And there are some important announcements. In this meeting, no one will ask about the medicine. No medicine related questions will be asked. ये मीटिंग में कोई भी दवाइयों के बारे में नहीं पूछेंगे प्लीज़, ये हमारा रिक्वेस्ट है. और जो भी if anyone is trying to join without names, we will be removing them. Because we don't want any problem in the meeting. And after the presentation, after doctor's talk, you can please raise your hand to ask your question. आप अपना हाथ ऊपर उठाने का जो इमोजी है उसमें क्लिक करेंगे तो आपका नंबर, आप सवाल सर से पूछ सकते हैं सर के प्रेजेंटेशन के बाद में. ओके, सो सर प्लीज
I
Over
will
to
tell
you.
in Telugu, please.
Yeah, sure, please.
యా ఎవరెవరైతే లాగిన్ చేశారో మీ పేర్లతో లాగిన్ చేయండి. మీ పేర్లు కనిపించకపోతే వాళ్ళని రిమూవ్ చేయవలసి వస్తుందన్నమాట. ఒకటి. రెండోది, ఎవరు కూడా కాల్లో మెడిసిన్ గురించి మాట్లాడటం లేదు. సార్ మనకి ఫిజియోథెరపీ అండ్ కస్టమైజేషన్ ఆఫ్ ద వీల్ చైర్స్ గురించి ఈరోజు మాట్లాడడానికి వచ్చారు. మెడిసిన్స్ గురించి ఎవరు కూడా దయచేసి క్వశ్చన్స్ అడగద్దండి. ఓకేనా? ఎవరికన్నా క్వశ్చన్స్ ఉంటే సార్ ప్రెజెంటేషన్ అయిపోయిన తర్వాత హ్యాండ్ రైజ్ చేయండి. మేడం అందరికీ ఆపర్చునిటీ ఇస్తారు మాట్లాడడానికి. సార్ తెలుగులో కూడా మాట్లాడగలుగుతారు. తెలుగు, హిందీ, ఇంగ్లీష్, కన్నడ. ఓకేనా? థ్యాంక్ యూ. సార్ ప్లీజ్ కంటిన్యూ.
1 second, Rama. Now people will say why we are saying in Telugu. We are saying in Telugu because we are having a physical meeting where this webinar is being broadcasted live. That's why we are talking specially in Telugu. Everyone can talk in their language. Okay. Yeah. Thank you so much. Sir, please.
Good morning, everyone. Thank you so much for me, allowing me to come and speak to you all, and for organizing this event by Bharat MD Foundation and organizing members. And thank you so much, ma'am, for introduction. Whatever you provide, very brief introduction provided to everyone. And thank you so much for Sneha Kamath, ma'am. Yes, we are we are family friends. Almost last 20 years we are together, working for the Sartha Kamath, and I feel proud to say that is one of my successful service user. We don't say patient, actually we say service users in Mobility India. Yeah, more than I feel successful. I'm so happy to see Sartha Kamath is achieving whatever in his life. Doing education, MBBS, become doctor, is practicing. I feel my personal achievements. So I'm so happy to see that. Yes, so I would like to take example of like how Sneha Kamath and their family helped to do Sartha Kamath. Similarly, I'm here in Hyderabad to help everyone. Yes, I'm part of one team member. Like you are also, as a parent, you are also team member to know anyone's rehabilitation. So everyone's cooperation required. So that's how we can achieve the whatever you wanted to achieve for the person with a disability, or it could be any disease like. So that's why cooperation of team members is very important. So today's talk is as introduced. So I'm going to share the screen now. Hope you are able to see my screen.
Yes, we can see your screen.
I'm making bigger. Yeah. Yes. That is about the topic. Yes. Today, majorly, I'm going to talk how important the customization assistive device. Not to go for any ready-made devices. What is available in surgical shops. Just buy and give it to them. Prefabricated may not be that much useful immediately to use it. So most of them, even the prefabricated, need to be adjusted or modified to person's requirement. So that is what I highlight it. And if you're getting anywhere, please come to us, like rehabilitation professionals like me or any rehabilitation centers, and make sure that is suiting to the person. Yes. So today's content is going to be. I'm just moving the slide. Yeah. So just a small introduction about the muscular dystrophies, as every one of you know, but still I wanted to bring the platform here and do oral assessment and prescriptions for the customization we need to do, and essential assistive devices which are required for the muscular dystrophies. Yeah, as we know, the muscular dystrophies, it's a genetic issue, and also it is a genetic mutation happens. That's the reason it happens, and it is one of the protein problem, like dystrophin protein issues. That's the reason these muscles get weak. The common symptoms, if you see in muscular dystrophies, progressive muscle weakness. So we see in these people, progressively the weaknesses will be happening as age happens. The muscle weakness increases. And we see some common symptoms with the weaknesses like difficulty in walking and running and jumping, and frequent falls, and delayed motor skills. And also another culprit is enlarged calves, and that is a pseudohypertrophy because of the calf muscles are become tight and strong, and that becomes the first deformity develops from there in the body. So this we need to, as a therapist, as a team member of rehab pupils, as a parent, you orthotist or any doctors, we are first this thing we need to prevent. And difficulty in breathing and swallowing, another things. And another symptom is scoliosis. Yeah, another biggest problem is that secondary problem is scoliosis. This need to be prevented, need to be worked on. And last one is that affects the cardiopulmonary things it may affect. So as a within the symptoms, now you can see whatever bolded, the progressive muscle weakness is what we need to work on. Okay, to delay the weakness, and enlarged calves, that is secondary problem, and scoliosis. So these things we need to know. We can slow down it or we can prevent it also. The scoliosis can be prevented if you treat well in early ages. So diagnosis point of view, we will do the first diagnosis. We try to find out by physical examination. 90% we confirm with this, but this need to be identified or they confirm the type of muscular dystrophy, that is by genetic testing and muscle biopsy, and sometimes with the EMGs and some blood tests. So diagnosis should happen before going for any treatment to understand the is it muscular dystrophy or what type of muscular dystrophy. There are many varieties of muscular dystrophies available. And based on the type of muscular dystrophy, the intervention, the frequency of the weakness, frequency of the device changes will be different. Yeah, common challenges in rehabilitation is like what we face. Is a progressive. This muscular dystrophy is a progressive in nature. The water treatment we are giving today, it may not be same after 2 years, after 3 years. So it will be different. And some parents think that the physiotherapy sessions or whatever the assistive devices given today, it will be lifelong. No, it may be changes as per the abilities of the child. The changes and the body growth and all those things also we need to consider. Also, these progressive weaknesses may lead to the impact on the mobility and breathing and heart function. So that also need to be considered while doing therapy or in interventions. And this ultimately lead to the psychological challenges. This has to be addressed by as a team of parents and the friends and other therapists. So these are the common challenges we see in the muscular dystrophies. The importance of early evaluation and early intervention is very important. Early identification. So this is how we need to know, as a parent, we need to see if any changes, any small changes happens that need to be identified or need to be diagnosed, to go to the rehab center or go to any medical doctor to understand. And so when we do early intervention, the benefit of early use of the assistive technology and physiotherapy is lot out there. So the early you start, as Sarthak Kamath was already mentioned, that they started early the intervention. They understood the diagnosis early, and they understood. They came to Mobility India. Then they came to me, and then we started doing physiotherapy sessions, and we started providing the preventive devices. We know that what is the steps next future, next 20 years, what will happen to the body. So those things we are trying to prevent it. Luckily, we know what it is, what is going to happen. So that has to be prevented. That is there. Interventions are available that need to be used well. Ultimately, by benefits, what we see is slowing down the disease progression. That is the only remedy what we are at this moment for muscular dystrophies. And maintaining the functional abilities is the aim of any rehab professionals by using assistive technology or by using physiotherapy techniques. That is the goal. What we are doing, it is not, I cannot say it is a cure what we are doing, but we are reducing the or preventing the whatever the effects of side effects or secondary effects of the muscle weakness or the muscular dystrophy features. And as I told you, in management, there is no cure for it, but we have managements. The first one is physical therapy. Second one is occupational therapy. Third one, assistive devices. That's what is today's topic. And medications. Few medications are required as per the condition of situation of the child. And cardio and respiratory care also very important to take care. So there are many things as I told you, management you can see. But today I'm going to concentrate on assistive devices. What is correct way? What is right way? Where to go? As a parent, you should understand and learn from each other as a parent and go to the right people, and the right devices need to be provided. Yes, the accessory devices. So this is the first thing I would like to mention. I think most of you have seen the children having this. The first picture what you are seeing, Okay, that is very important. That is, a calf muscle is getting tighter. Whole body is getting weaker, but only this calf muscle is getting hypertrophy. So it's called pseudo hypertrophy. So false hypertrophy. It looks like muscle is building up. Muscle looks very big, but that is causing the foot, the ankle to go down. So if you start preventing this, many things will get prevented, including scoliosis, including sitting posture, including standing posture. So the secondary complication is the first thing what you need to concentrate. So first, whatever picture you're seeing here, first picture unit is of stage 1, and stage 2 you can see what is happening. The ankle is not only down, also twisting inside. Then stage 3 you can see the ankle twisted and everything. Then you can see start the hip, ankle, and when it's affected, knee and hip also get affected, get contracted, and the pelvic is also deviates, and ultimately the scoliosis not able to sit well, so the scoliosis start developing it. So this is the first thing we need to work on through physiotherapy or through assistive technology. This is uh, uh, preventable and should be controllable. We can keep it in limited range, limited contractions level. And next one is scoliosis. Secondary complication is, so this, if you prevent it, the child life or quality of life will much better. The chest complications, the cardiac complications, posturals, functional positions. No, they're able to go to school, able to sit and write and watch TV or eating, feeding. Actually, many things affect with because of this. Prevent this, so child quality of life, and you are maintaining or managing the child, daily routines will be much easier for you if you prevent this. So it is preventable. And third complication, what we see usually, because of their functional abilities coming down, they're always kept in a one position, because maybe sitting position or just lying position. Due to that, the bone density density comes down, and because of that, you can see the bones become weaker and more chance to have the fractures, because of bone is not strong. There are more chances to have the fractures. It's called stress fractures. Yeah, another complication is weight issues. So some children may gain extra weight, or some children may lose the weight. So it will be extreme. Sometimes they looks like malnourished. Sometimes they become very heavy. So that you need to be addressed it well, because if they position well properly, you can see swallowing and everything will be better. When swallowing is, if there is no difficulty in swallowing, no issues. Then the weight will be maintained. And if they use their energy, whatever they eat, the energy should be used. It could be sitting activities or standing activities should be done. When they're having the ability of walking, we should make the ability of walking. That is called physically, we have to keep them active. So next one is last complication and breathing problems. You can see because of scoliosis, one of the lung is completely collapsed. Then oxygen intake automatically comes down. So this also can be prevented. Yes. So when you have all these 5-6 complications, whatever it is, all of them can be prevented if you start early. So one deformity in the foot can lead to deformity in the neck in the future. Okay, neck deviation or swallowing difficulties. No, this all may come up. So it is very important to take care of child in early. So why assistive devices? Assistive devices majorly to maintain the mobility and stability. So mobility and stability is one of the goal when you use assistive devices to achieve. And with their what happens, they will be able to perform their daily activities easily. The performance of daily activities not only by themselves, sometimes by attenders. The attenders, who are helping them, it could be parent or your grandparents or who arranged attender. For them, it will be much easier, their posture and the body physical abilities in a neutral position. So the another purpose of this assistive device is ultimately this helps in enhancing the overall quality of life. So assistive device is majorly the quality of life it is going to take care. Yes. And this why we customization we are talking. The customization why we talk. Every child leg is different. The bone length growth is different. The deformities levels are different, and the progression is different. So individual progression is happening. So you need to address it individually and provide the devices, especially ankle foot orthosis. That for what we provide ankle, it has to be provided individualized or taken customized devices, and so that we will able to maximizing the function and comfort and promoting the independence, and that also helps in the preventing secondary other health issues when you provide the customized devices, and enhancing the psychological well-being when they're doing their abilities, the posture is correct, ultimately they look confident, and the posture is well appearance if is there. Ultimately, the sitting, the open chest is there, open shoulders. No, the neck is in the middle of the trunk. So the psychological well-being also much better. And so here, whenever you're doing a customization of providing a management of person with a muscular dystrophies, it is a multidisciplinary team. Please understand, it's a multidisciplinary team. I'm not saying only physiotherapists will be able to do all these things, or only orthopedists should work on, or a cardiopulmonary specialist should work on. No, it is a team of people, and we should work with the coordination with everyone. Yes, so these are some of the common people who works with the uh, person with the muscular dystrophies, like service users, caregivers, family members. Then rehabilitation engineers, prosthetists and orthotists, occupational therapist, and physiotherapist. All of us should work together in management. And role of multidisciplinary team not only in the providing assistive devices, and also will take care of the technical not only physical abilities and disability taking care. Also, we try to see along with the physical abilities and the difficulties, we'll also see how their lifestyle is there. Based on that, also devices will be prescribed. How their environment is there. It could be bathroom size, or bedroom size, or a dining area, a school area, or the car what they're using, or transport, whatever transport they're using, whether going to school or going to the office. So all of this need to be addressed, and with the help of them, the assist devices should be provided. And the goals need to be what they want to achieve, what they want to go, whether they want to go to school, or they want to go to work, or they want to do some kind of entertainment activities in the home. Some people are just taking the wheelchair or any devices for the they are good at art drawings. So that kind of workstation when you're designing also will be helping them to provide assistive devices. Yes. So when I'm talking about as common assistive devices, what I mean to say, these are the commonly which we prescribe as a physiotherapist in Mobility India, which is required by the person with the muscular dystrophies. Yeah, first one is orthosis. Orthosis is nothing but which is applied to the body. Like it could be, I'm going to show some example. Positional devices, nothing but is a specially developed device like chair, special chair we say, or standing frames, or a floor table. So I'm going to show some example. Positional devices which keep the child in a particular position. Then postural supportive wheelchairs. So that is a wheelchair which is it's a just wheelchair. We should not just take it actually. Any DMD, whatever state is, the wheelchair has to be taken in future that the attachments can be given for the purpose of the postural purpose. The child should be sit erect, upright, so not to develop any scoliosis or the deformities in the neck or the trunk or in the legs. The last one, ADL devices, which I'm going to talk in the coming up slides. Yes, common orthosis in muscular dystrophies. The first one is AF. So prevention of the pseudohypertrophy or due to that equinus deformity or tear tightness to avoid it. And many cases come from the Nemans, Bangalore, where our head office is very close to Nemans, Bangalore. So all the doctors refer them and we provide them. This orthosis can be provided for as resting sprint, sometimes some children for the standing purpose, some to walk few steps also. We need to decide based on the knee and hip strength how much is there. So ankle foot orthosis is one of the common devices which we prescribe. And this I'm not saying to everyone. We need to see the stage and we need to decide when to provide this AFO. Yes, so whenever providing AFO, there are many AFOs I've seen in Hyderabad, in Bangalore also, but majorly I'm seeing Hyderabad. Please go to the proper center who can take the measurement and provide. The measurement means not with the help of the tape. Okay, it is with the help of the plaster of Paris. Okay, the mold with fast we will take prepare the mold with the help of the mold only it has to be fabricated. For example, I can show you that the two type of AFOs are there, and you can see that L angle how is 90 degrees maintained. One is not 90, is not mentioned. There is no foot design, foot trim lines are not mentioned, not maintained. So you can see. Hope you are able to guess which is right and wrong in this. Okay, so I think you answer yourself, and just I'm going to see this pair or this single device is not correct way is made because of is not maintained 90 degrees or because the trim lines are not maintained well. So due to that, so you need to go to this orthotist who can fabricate well. I recommend who is uh, passed out from the National Institute or the only 15 colleges are there in all India. That's a big challenge identifying orthotist and prosthetist, identifying. But please understood that if they have done the Bachelor in Prosthetics and Orthotics or the ISPO, International Society of Prosthetic and Orthotic courses, they passed out, then they are able to prescribe and design properly. Okay, so this is AFO, but what is wrong AFO, right AFO, so you should be able to identify. Next one is some people may require for the knee, they said long duration knee also may get contracted, knee flexion defund may come. So for them, we design a customized mediators. Yeah, spinal braces. Yes, it's already started developing as a prevention. We can do this type of spinal braces. The example you can recently we have provided mobility in Hyderabad. The child is a congenital myopathy, and you can see the child started developing this lordosis as well as scoliosis. You can see the wrinkle here. So I'm just going to mark it here. So this is the starting stage of the scoliosis. You can see the wrinkle and the child developing the scoliosis such a way. It has to be straight line. But you can see left side is popping out and right side is popping in, pressing down. So crease you can identify, you can see. So to avoid it, so they started providing. This client is from army. The father is from army. Is nearby military hospital is there where Tirumalgiri we are living there. So from there this client is referred, and but these parents are actually from Bihar. They could stay for 1 week and they have taken this device and went. But the father is posted in Tirumalgiri in Secunderabad. This was just example recently what we provided. Yeah. Yeah. I'm just moving the slide. It's not happening. Oh, cannot remove. Okay. So next one is position devices. Hope you are able to see this. So early age try to provide the proper device. If they're don't think that they're depending on these devices. These are just a chair, but try to avoid putting them in the sofas or in the bed without any back support. Please don't. So that is because when they're doing homework, when they're eating, when they're watching TV, this is the time where constantly they'll be sitting in a particular position. So always early introduction is very important. The floor table is something where they're doing the homework activities like school activities, but they come and do at home, writing and reading. Even feeding activities also we try to provide them this floor table. But if our lateral stage, special chair, which provides you can see the lap tray and the side support, the cushion, everything is there. So entire this high sitting purpose special chair we provide. Next one is we provide standing frame. So if their abilities are standing with a walker or walking with a walker with a A4, then we no need a standing frame. But when they start reducing standing time or walking time, then you can start introducing the standing frame with the product in place, and they can do standing and or do some functional activities ultimately. This device is a positional device we say, and standing frames also comes in a different designs and different ways. You can see first one is the box type, front support is there, and the second one is front support. Is like not box, but is a support. Pale support is there with less support, but it still protects the person. And there is a prone standard, third one, and last one is a tilt table. What you're seeing recently, also one or two DMD cases children have taken. As a floor. Ultimately, the purpose is to make the child stand up, and we need to understand their requirement, their workplace availability, and people availability also, number of people availability to make the child to stand up. So the last one is much easier to make the child stand up, but require more space in the home to keep this device. The first one is required people support, one or two. Physically, you need more energy to put the child inside this box, but less space it takes. So these all, when you talk, is a lifestyle or people around whose support system, services, attender support system who is there. So that way we are going to decide these devices. So why we need to stand upright? So I have a small short video. Let's watch this video. What are the benefits when you make the child stand up who do not able to stand? So hope you got those points. It is majorly, to prevent the secondary complications and to improve the blood flow and to have a strong bones and have a good breathing intake and digestion. And of course, a secondary complication like so if the sitting long duration also can have these pressure sores or the calcification in the buttock region or calf regions. So these all can be prevented when they properly made stand in a more frequently than making them stand up. Yes. Next one comes the key thing, postural support wheelchairs. Why I'm putting the postural support wheelchairs? All DMD children's or DMD or whatever other muscular dystrophy children's are required postural support wheelchairs. It is not just a wheelchair, postural support. Or presently, if you're giving any active wheelchair or whatever, but the chair has to be provided such support. In future, future it can be converted as a postural support wheelchair. So that's we need to keep in mind. Okay, and I want to just bring it is the wheelchair service provision is so much is gone now. Oh, I want to tell the WHO has done a lot of work last 15-20 years. So that as a parent you should know what is WHO is doing, World Health Organization. Hope you know, Prapancha Arogya Samastha. So that is made a lot of momentum in the wheelchair service provision, not for only for India, for worldwide. The wheelchair is seen this device as a donation item. Okay, donating and just to take a photograph, it was happening earlier, and this has been identified always everywhere. This wheelchair has to be happen through service provision, proper professional service provision should happen. That's the reason the WHO has come out with in 2008. You can see the guidelines have come up how the wheelchair service provision should happen. Again, this is revised into 2023, 2 years back. It is again revised and provided the wheelchair provision guidelines. This is available. If anyone wants these books, please. There is a you can see there is our official number is there. 9002986882 to contact me or to ask any question or to ask any books from here or any content from here, please ask me, I can provide you. Yes, so worldwide what is happening, you can see this. Hope you understand what is happening. So I can see the common size wheelchairs are given to the any child size is there. The child, it's some bigger child is there, small thin child is there, small child is there, but still the single wheelchair is provided to them, single type of wheelchair. So this is a mass distribution is happening, and we need to professionals should be involved, need proper measurement to be taken, proper prescriptions to be done. To small child means that as per the size of the child, the wheelchair should be provided. So we are not providing just chair with the wheels, right? So we need to provide a chair which can support the posture, which can support the. You can say first child is almost falling out. It's not at all supporting his posture. Second child is okay, seat wise, but you can see feet is hanging. Third child is it is almost sitting in a cross leg sitting, and it's like a small in a big wheelchair, small baby. I don't think so that's at all useful. The child already scoliosis is developed and falling down one side, and you can see fourth child is all completely twisted. Knee joints are bent. Any question? Someone unmuted and talking to me?
Sorry, sir. I have unmuted them. Please carry.
Oh, yeah, sorry. So fourth one is fourth child. You can see is very thin child, but you can see so big wheelchair is given. You want a support from a wheelchair. Due to not getting a support, what he did? He fell an armrest with axilla. Axilla is falling on armrest. Now he's taking support, and to take the support, ultimately is deviating one side. And when he deviates, sitting along with what happens in the spine? Scoliosis. Okay, this is a simple picture I'm using everywhere. I received, I think I was a part of this program, but we are not going, but I've seen this program. I've taken picture with the permission and to show the people how the wheelchairs are happening. See, whoever providing money, they are good intention. Whoever is doing this NGO support or whoever coming and organizing this event is very good. Parents also come with a lot of hope, okay, this will be useful. But here the professionals involved, correct wheelchairs should be given. Now that's why the WHO come out with the proper assessment prescription protocols. So ultimately, if you provide something like this, common size wheelchair to everyone, whatever the child situation is, but it is found that there no scrapping is happening more. A lot of resources getting wasted. Resources could be anyone. It is a country's resources. May not be individuals' resources, but it's country's resources getting wasted. You can see, and these are the pictures. If I go to many institutes, I've seen the wheelchair, they take it and they're not able to use it, they dump it. Also, to support this whatever just now we said, there is a research has been done in Tamil Nadu to understand how this mass distribution wheelchair service provision is, how much is useful. With that, it's understood only 7% of the out of 100, only 7 wheelchairs are getting used to regular use. 21% is rare, occasionally they are using it. No, whenever they go out, no, sometime, because regular they cannot use it. 72% of them, okay, they're not at all using, or they sold it. So this is our one recent, not recent actually, almost 20 years back study is identified what is happening whenever a mass distribution type of wheelchairs are provided. It is a lot of waste of resources. You can see 93% wheelchairs are not getting used if it is without proper assessment, without proper customization, proper user training, skill training, how to use a wheelchair in their premises. Could be reason, there are many reasons they have identified, but this is a situation. 93% of wheelchairs are not getting used with the mass distribution are done. So next one, I would like to say, what they provided in the wheelchair guideline. These are all chapters they provided. This book, if you want, you can download it, or you can ask me. I can also provide the PDF. Okay, the 5 chapters are there, especially they discussed in the introduction, design and production, service delivery, training, and policy and planning in the government, how it should happen. And after these wheelchair guidelines, WHO came up and come out with some training packages for a professional like physiotherapists like me. So before these guidelines, we are practicing Mobility India. I received a training from Motivation UK. It is again an NGO. They came and trained us in 2006. I was some practice on this. And 2000, you can see 2012, there are manuals, there are courses have come that is called WSTP. WSTP basic course system, then 2014 WSTP intermediate courses. So whoever does these WSTP intermediate courses are eligible to provide a support, postural support to wheelchair for muscular dystrophy children. Okay, this level of training is required. I think in my introduction, I think also it's mentioned that in that my introduction, I have undergone these courses. I have the pilot trainer in developing these booklets from India, and undergone, and also I'm the master trainer for WSTP courses. Then in 2015, WHO released WSTP managers courses. The managers courses could be like it could be any college principal, any managers. This may not be technical person, may not be physiotherapist, but who is managing the organization, or who is managing the policies. This managers course can also attended by parents, or the now your parents association members, leaders can attend this and understand how a wheelchair service provision should happen. How should be this bring into the system. In practice, it could be in government, it could be in the private sectors, or it could be NGO sectors. Then 2016 onwards, and how to TOT programs, how to equip as lecturers or the trainers to give this training on this. So this is what I'm trying to say. So professional, we were giving these wheelchairs, we are undergone these courses, we are trainers in this, and we are providing trainings to other physiotherapists and other professionals in this. So that is for your information. So in this package, whatever we learn, any wheelchair to provide, there are 8 steps involved in this, guided by the WHO, saying that we need to follow these 8 things should happen before delivering a wheelchair. So in a wheelchair, what are key things? Which key types of wheelchair service provision happens? One is custom fit wheelchairs we provide, manual wheelchair we provide, power wheelchairs we provide, and tilt-in space wheelchairs and standing wheelchairs. So these are major types what we based on the requirement we do it. And there's you can see, you can pause and see when you afterwards, there is a purpose, there is a benefit for each one. But as a therapist, we will help you out in choosing the appropriate way. So there are some few examples of, there are many varieties of manual wheelchairs available. The middle top one is Sarthak Kamath was using, I think almost 15-20 years he's using this. Now I think he shifted to the motorized wheelchair recently. Otherwise, previously was using majorly this manual wheelchair. I think this down one, I'm not promoting individual wheelchair, I'm telling muscular dystrophy means everyone gets common wheelchair. No, see, muscular, based on their lifestyle, based on their requirement, we have prescribed this. I prescribed personally this middle one, top middle one, and lower one, first lower one. This is for the one of the I think Rama Madam's son using this. So this varieties of wheelchairs are there. This has to be prescribed with the help of the parents, with the help of the child abilities assessment, and also available products also. Yeah. These are the example I'm showing. Any postural support wheelchairs, will not be ready to give a wheelchair. most of the wheelchairs has to be customized, has to be modified, are adjusted. Now, this particular wheelchair, we have done many modifications, many adjustments. You can see, okay, this blackboard, what you see on top of it, it is customized to the child. I delivered in Vijayawada, near Vijayawada. This child I went and delivered, and this cushion you can see, pressure lift cushion. You can see the footrest. Footrest is not equal. No, see, one leg is up, one leg is down. Footrest also modified. You can see here also the footrest changes. They wanted reclinable wheelchair. We provided with all the postural support devices. And this is another model. This is cerebral child we provided, but I'm just trying to tell you how the modifications are happening. What are the modifications we do? So this is another modified wheelchair. It's a basic wheelchair without recline option, but still they wanted a wheelchair something like this. As we understood that the postural support and the belts, straps, cushion, comfort, everything provided in this. And these wheelchairs are provided in one of our project area in Tumkur. You can see the children, everyone, you can see there are AFOs are there. Okay, this first child is a DMD child, but rest of them are not GMD. They're with a cerebral palsy or some other disabilities. You can see proper postural support is provided with the proper stoppings, you can see there. Hope you're seeing the mouse where I'm moving. It is a fourth child, head support and the lateral trunk support. The trunk not to deviate any side. So, and you can see footrest if it's hanging. You can see here how the block is provided. Foot has to be supported well. Someone raising hand, you mean to talk something? Pooja raised.
Sir, we will give at the end of the presentation,
Okay.
sir. We
Sure.
should not disturb in between. Pooja ji,
Sure.
we will give you opportunity later.
Okay, फिर आप चाहिए तो वापस आ जाएंगे स्लाइड पे बात करने टाइम पे. चलो. So then another one is this cub wheelchair. I want to just tell you, is a posterior wheelchair. Recently, last 5 years, I'm personally working on this cub wheelchair, and we are part of the Indo-US project. We have done this clinical trial in India because this is a successful product in USA. The technology to bring it to India, then I have done a personal around 15 children's clinical trial I've done in Anantapur in Andhra Pradesh and Bangalore slums. We have given 15 wheelchairs and we tested for 1 year. I observed this wheelchair, how it is helping them, and frequently I was in touch with them, and it's majorly how it is helping postural support, how is lifestyle. Now it's in the home or it's in the school. We have tested, and we've seen it how it is useful, and also we given a recommendation to. We received a recommendation from parents and attendants and children, and to improvise this product. Now this in India is available for us. It's called Cub wheelchair, and is imported from the US. I mean, technology imported from the US, but it is available in India now. So next one is motorized. There are wheelchairs. I can see some of you guys are also taking motorized wheelchair. Please take motorized wheelchair if required. That makes the independence of the child who has the IQ is good and they are able to manipulate with the hand. I mean, able to maneuver through with the hand. So they can do it, but at the same time, these wheelchairs cannot be given directly for muscular dystrophy children. This has to be customized. Proper postural support should be provided, including cushion, strappings, trunk supports, footrest adjustments, lap tray, whatever is required. We need to adjust it. All motorized wheelchairs are required adjustments, are required accessories to add so that the posture is support the postures. That's what I'm trying to say. So, of course, the abilities of propelling with both hands may not be possible. Maybe some people can do the joystick. Should go for this. The prescription is okay, but add the customization. Yes, motorized wheelchairs also available. There are like advanced technology with the recline options, tilting space, recline, tilting space, and even stair climbers also available. So technology is there, but only thing postural support attachment is very important. It's not that if you purchase for 5 lakhs also still they require a customization. It is not that how much money you are investing, how much things are there which is supporting the child posture ultimately, trunk especially, and trunk and foot is very important. Yes, so here are some of the features what we need to look at whenever we providing a wheelchair. The first one is adjustable backrest and headrest is there or not there, you need to see. Pressure relief cushion is there or not there, you need to see. If not there, we need to provide because they cannot pressure relief themselves by moving forward and backward. So the cushion has to be pressure relief. The joystick options of alternating options we need to provide, right side, sometimes left hand, sometimes we should be able to do that. And wheelchair accessories like tray, lap tray, or any bag is required, we need to see whether it's available to put it. And also maintenance and support system is available or not. Whatever wheelchair you take it, ultimately that requires service. Whatever bike you're taking car, right? Every 6 months, 3 months, sometimes 1 yearly once, you do a service, right? Similarly, wheelchair also requires servicing. Once you take the lifeline, it won't be in same status. Every assistive device require regular follow-up, regular servicing. It could be simple repairs, simple oiling, simple adjustments, the nut bolt tightening, all those should happen. Then only the life of the wheelchairs will be better. So the further maintenance and support system is very important. Yeah. These are some of the purpose and benefits why we do this. I'm going to detail. I'm going to talk. Later, you want to read about this, you can pause it and check this video. The next one is pressure relief cushion. What I just mentioned, the second point. So pressure relief cushion very important. Mandatorily, you need to provide for all person with the muscular dystrophies who are using a wheelchair, who are using the postural support chair, positioning chair. They need a comfort cushion or pressure relief cushion. Pressure relief cushion. The first function is comfort. Second is postural support, and third one is pressure relief. Pressure is nothing but if who are sitting long duration, they will get a pressure sore or pressure soreness. They get it. May not be wound sometimes, but they get a numbness. They'll get it. After some time, it may break and open the wound. So to prevent it, pressure relief cushion is going to be useful. Sometimes postural support cushion also be provided along with the pressure relief cushion. So these are the postural support cushion. Based on the requirement, we decide. If someone having pelvic tilt, someone having a thigh rotating outward, inward, someone's pelvis is rotating backwards, so pelvic rotating forward. So you can see some example technical what we use inside the cushion. This all we decide, we prescribe based on the child pelvic stability and abilities. Next comes to the some of the postural support devices for the trunk, for the foot, for the thigh. You can see different wedges. Foot wedges are there. Between thighs there is wedge. To support the thigh not to roll outside, there is a block. Trunk not to deviate, there is a block. So you can see that how adjustment we do. These are the postural support devices. Then next comes to the straps. You can see the picture. So straps need to be provided as much as required only, not unnecessary stoppings. These are rarely we provide, but we provide for the best one is the minimum one is the pelvic one, the middle one, whatever I'm showing it. If it's required, minimum need to provide. Other straps are whenever is required only a later stage of the person requirement we do that. Then wheelchair user training. So whenever we provide a wheelchair, the parents and the wheelchair user has to be provided a proper skill. Okay, for example, how to handle a wheelchair, how to fold, unfold, folding and putting inside the car, folding and storing, could be any purpose, but how to handle the wheelchair we need to provide. Sometimes wheel detachable option will be there. Okay, footage detachable option will be there, lab board detachable option. All this we need to demonstrate. Second one is how to transfer the wheelchair user to onto the wheelchair. Wheelchair techniques, transfer techniques we need to teach. Then third one is wheelchair mobility skills. How to use a wheelchair on different surfaces when you are assisting them. Okay, it could be independent wheelchair mobility skills or assisted wheelchair mobility skills you need to train. The fourth one is if they can able to do way to prevent the pressure source. Okay, and if they're sitting some like a Sardar Kamadi was sitting in a college morning to evening, 6 to 7 hours is sitting. So how to do a break, how to pressure relief himself from the bottom region. So there are methods, techniques are there which we can train. Then also fifth one is how to look after a wheelchair at home with a simple repair and maintenance. Sometimes to the wheelchair user, if DMD or any muscular dystrophy cases, sometimes we teach this technique to the parents. Yeah, other aerial assist devices also is very important. It's not only just mobility devices, also this is also very important to have a to simple independence you will get it. For example, bathing system. So giving a bath to a child with the muscular dystrophy, okay, they have that much ability to stand and take bath or sit in a regular chair to sit bath. In the bathroom, again, it's very slippery area, water is there. So you have to be very careful whenever giving bath. So this is one of the system we trying to introduce to you here. There are many options are available. I'm just one of the example I'm showing bathing system. Next one is transparent bathing systems. You can see here. So there is a hoist is there. There is a bathing transfer device is there. It is no need to transfer there in the bathroom. This device only comes to the bed or the sofa or wheelchair, and you can transfer directly to the. I'm going to demonstrate this video. they'll come and transfer first on the bed to this device, and this device you can go inside the bathroom, take bath on this device only, bathing, toilet activity, everything you can do, finish it and come. Usually we recommend not to do any transfers inside the bathroom because it's a wet area and it's very slippery and more chances to have injuries inside the bathroom. So that's the reason this second and third device is recommended to use as a bathing system. So this is again I'm telling that this transfer chair and transfer chair come bathing chair, you can use it. You can use it for transfer purpose. You can use for toileting activities. You can use it for the bathing activities. I'm going to play the video. Please have a look how we really use it. So this, whenever you're prescribing device, it's not that easy to just, okay, you've seen this video, I will take it. No. So whenever you're prescribing, the environment is very important whenever you want to use this one for you. The bed design is very important. Bed height is very important. Similarly, the bathroom door width is very important. And the commode, by inside the bathroom, there is a space also very important. These all need to be considered before selecting this wheelchair. It is not that prescription of the device is good, so we'll take it. It all matters whether it suits your lifestyle and environment, house environment. No, it's still required or not required. First thing, if required, it suits your environment or not required. So before taking this device, please make sure that you check all of these points, because once you take it, returning people again, you will be looking, oh, it's not useful in my home. Okay, it is not how the bathroom is not that wide, or the bed is, there is no space to go inside. This is all you discuss. So please, I mean, don't not take just whatever you're seeing here. Please contact any professionals before taking any device. So here is just awareness for you, not to prescribe your own device here. So that's what I'm trying to tell you. I'm not recommending anyone to go and purchase the products. Okay, the major thing is the proper prescription, proper customization should happen. Yeah. Some other devices like available if required, reachers and grabbers. And someone is moving a wheelchair and going and they're not able to grab something, you can have this reachers and grabber for them to pull the device, pull the shirt from the hanger, a book from the place, from different place, you can do that. Even glass from the shelf, you can pick it up. Next one is button hooks and zip pulls and adaptive utensils and shower chair and bathing benches and the toilet seat raisers. It is before going to the wheelchair, but before, I mean, they are able to move around, but still require some assistance to get up and sit. You can use these last two devices: shower chair and bathing benches or toilet seat raisers. Could be a limb-girdle muscular dystrophy. They require like 5 to 10 years these devices before they're getting into the any complete wheel sitting mobility. Okay, you should think about, I mean, what type of muscular dystrophy, the time and duration, how many days they require these devices. Based on that, you need to purchase these devices. Other devices like bed rails, dressing sticks, sliding transfer benches, modified door handles and knobs for taps, sometimes they can use, and voice activated home systems and portable ramps. So these all available. I need to see only whether required or not required. If required, you need to purchase. And please contact professionals and before going for it, and they will put a question whether this system available or this issue is there or not there. Based on that, they'll help you. The next one is I mean, same picture I'm just repeating. Sometimes no accessible toilets is very helpful. So you can see how the accessible toilet is there here. There are rails and there are toilet raiser. There is a hoist system is there. You can think that accessible features in a bathroom, how you can design it. So the environment devices orally, if you see the ramp comes, then switchboards, toilets and bathing system area, and transfer devices. These are some environmental devices. If you want to, modify, we are building a whole house now, for example, think about all these things. Okay, as per a study of what I understood it's mentioned one of the study, WHO material. Okay, if you instead of putting a steps, putting a ramp is much cheaper than the steps, material and everything with it. No, I mean the construction material point of view. So you design the home before only. It is not only for person with the muscular dystrophy or person with anyone. Is also all these features. What is there? Everyone is required. Environment device is required by everyone. It could be senior citizens. Your knee pains when you get it. Okay, or once you 60 plus, you require all these features, whatever is mentioned in this device. Okay, don't think for I'm doing something for your child or I'm doing for something for my parent. It is for may not be now if you're physically strong, but is required by everyone. So the universal is called universal designs. Please think about universal designs when you're constructing house. Think about universal design maps and take that and insert or manufacture or the construct your house in such a way. Yeah. So I want to put 3 slides here before finishing my session. WHO come out with the priority assistive product list. This list, if you want, please text me. The WhatsApp will help you. So this 50 devices mentioned in this, and WHO is coming out with a assistive product list, essential medicines, how it is available in every medical shop or every primary health centers. So essential priority means essential assistive product list is available, and WHO announced it. Based on the WHO announcement, now Indian government also in 2023, it is announced that is called NLIP list, National List of Essential Assistive Products. It is available now. In this also, many products Indian government is saying that is essential to make it available in the rehabilitation centers like Mobility India or Indian government rehab professional centers. Next, I would like to say now WHO also after this, WHO also come out with some training programs for professionals like physiotherapists, social workers, and doctors. Anyone can undergo this. That is training in assistive TAP course is available to make sure that the people should be able to prescribe assistive products effectively. So these are the courses at this moment. 25 modules they're trying to develop in the mobilities. You can see in mobility there are available already: walking aids, portable ramps, transport boards, therapeutic footwear, rigid removable boards. Then self-care devices, then hearing aid devices, vision, communication, cognitive. These all modules are available in the WHO package or WHO websites, and the professional need to be undergo. That's what they say. Yes. So this is a summary now. I hope I made some useful information I brought here. How the assessment, prescription, and customization is important. So today, what I discussed today with you all, muscular dystrophy, it is a progressive genetic disorder that affects the muscle strength and function, and early intervention is very important. And that is early intervention is one of the intervention is providing assistive devices and physiotherapy services. Then customized assistive devices need to be provided. The devices that can be for the devices for mobility and posture, the devices for the to prevent the secondary complication, the devices which can help the daily activities, and also the devices can also helpful in the psychological well-being. So these all need to be provided. It could be orthosis, wheelchair, ADL tools, and environmental modifications. And in provision of all these services, and the multidisciplinary team is very important. It could be orthotist, physiotherapist, occupational therapist, rehabilitation engineer, and the caregiver, parents. Everyone should be involved in prescription and customization of the products. Yes, when you're providing any devices, ultimately that should be transferred with the proper skill training. That is user training and maintenance, how to maintain the devices. So that is a summary. I think now, ma'am, we are open to questions. Thank you so much.
Thank you, Raj Garu. It was very, very informative, and few of it was enlightening also. मैं हिंदी में बात करना चाहती हूँ. बहुत ज़्यादा जने हिंदी समझने वाले ज्वाइन किए थे आज. आपका जो भी क्वेश्चन है आप हिंदी में पूछ सकते हो. सर कंफर्टेबल है हिंदी में आंसर करने के लिए. If you are comfortable in Kannada or Telugu, also you can speak. This is what we want. Sir, before anyone asking, I have a question. That's the reason I also raised my hand.
Yeah, sure.
As you mentioned, like, is there any statutory rule or any regulation saying that any wheelchair vendor selling should have this particular certification with them? I mean, I know you're a physical therapist, I know you're a physiotherapist, and after that, out of your interest, you have done all these courses for the assistive devices, etc. Is that any compulsory done by WHO or the ICMR? Because whenever we walk into a surgical, this one, what is a wheelchair you want? What is a kid's age? Okay, take this wheelchair. This is what is the normal process is going on. Just हम जाएंगे शॉप को, पूछेंगे हमारे बच्चे को व्हीलचेयर चाहिए, हाँ मैडम आपका बच्चे का कितना साल है, ये ले लो. बट दिस कस्टमाइजेशन ये पूरा किसी को भी वहां पर ही नहीं पता होगा. इसलिए इज देयर एनी रूल बाय द गवर्नमेंट सेइंग दैट यस दिस शुड बी, ऐसा कुछ है क्या? आउट ऑफ क्यूरियोसिटी आई एम आस्किंग.
There is no rule by the Indian government or by WHO, but they provide only guidelines. Problem is that, okay, but there suggestion also in the wheelchair. There is a system in wheelchair manufacturing also. It's again, it's not a rule. I there is a ISO 7176. Any wheelchair what you are taking, that should be undergone the test name is called ISO 7176. Okay, but not in India. Okay, but generally we whatever mobility in what we wheelchairs we procure, make it available for the people, ISO 7176. So that test need to be undergone, then the product need to be first we need to take. Second one is WHO says provides the guidelines. You need to assess and prescribe and modify as per the child requirement or life physical requirement. It could be lifestyle requirement. These are all guidelines. These are all the recommendations. But we cannot immediately stop the everything what is available in the market and go to only rehab centers and take the wheelchairs. But we are trying to groom the physiotherapist or the rehab center also groom to make their strength in the prescription assessment and service provision one side, and gradually as like now service user like you guys, parents now think about coming to the rehab centers for assess wheelchair prescription or wheelchair modification. That momentum should happen automatically, only they're expecting. But there is no standard saying that we should, there is no rule to close down the some particular service provision system now.
ओके, मुझे ऐसा लग रहा है कि पेरेंट्स को इंफॉर्मेशन जानकारी रहना चाहिए इसके बारे में, तभी पेरेंट्स पूछ सकते हैं कि मेरा बच्चा इसके साथ है, आप कौन सा मॉडिफिकेशन कर सकते हो और नहीं तो कस्टमाइजेशन क्या कर सकते हो. आई थिंक द मेजर रोल टू बी प्लेड बाय इज द people who are buying the wheelchair.
Yes,
they should be more of educated. No, I'm not saying that what is to be done, but at least parents should know that the customization is an important part in buying the wheelchair, just
correct.
not taking it from the shop.
Yes.
Okay, I
That's
think
yeah.
Pooja ji
Just
has raised after that. Sharda ma'am, Pooja ji, please go ahead. Please unmute yourself. I hope you are able to do it.
Yes. Hi, I'm Pooja's husband, and my son Arav is suffering from DMD, right?
Okay.
And first of all, Dr. Sama, thank you very much. It was very insightful of all these experiences. And the reason, like I raised hand, is because the symptoms which you showed, my son has developed that. He's 12 years of age, like contractures, back, a little bit of back cirrhosis and all that. We stay in Delhi, right? My question is like, if we need to connect with you for all these devices so that the progression is stopped. So will a Zoom meeting appointment will help, or we need to bring our child to Hyderabad to get all the required assistive devices? Because as I mentioned, like it is now a must, right?
Yes.
So
Yes.
I like expenses definitely would be there bringing him to there, but still, if it's a need of the hour, then we will try to manage it. But please guide us on whether the first assistance showing him to you through Zoom, and then how we take it forward so that we can customize the wheelchair and all, because it is very difficult. His weight is like right now how we are managing is me and my wife has to pull him up to to put on the chair, then to go to toilets and that's so our we also sometimes feel that we should not be like our spine should not go down, right? So that's
Yeah,
where the customization. We have the wheelchair, we have the chairs, but that is spoiling his body
yeah,
structure. So
yeah.
please guide on that. Thank you.
Sure. Yes, first thing is what I said, the service provision available in whole India. Only thing we can guide you in that. First week, what we can do assessment, Zoom meeting or online video call assessment we can do, and then we can see and understand what are the requirements of the child and parents for you. Then we can guide you and give a network connection we can provide you. For example, someone required AFO in Delhi like you, we have connections who can do better AFOs like mobility in the way we manufacture the proper AFO who can manufacture. We can give a contact to you. And if you require a wheelchair, then we can tell you based on the devices, we'll tell you where to go. Some we can provide some from here, but some you can provide. We can give a connection where you can go. But yeah, we can as you asked, we can help you out in doing your initial assessment and guiding you the devices.
Thank you. So we will book a assessment with you of my son.
Yeah,
Thank you.
I can. Yes, you can. Your number is displaying there, right, in the screen. This is our
Yes,
office number.
we'll
Office number
take.
down. Yeah, please note down, and you can introduce yourself, and we can pick up a appointment.
Thanks a
A
lot.
small
Appreciate.
request to Pooja's husband.
Yes, ma'am.
Because you are in the northern part, in your area, if you can do a group of people who require this, then I think Mr. Samaraju can come there.
Okay.
I mean, for 1 day or so, wherein
Yeah.
that can be organized by the foundation.
Yes.
If
Okay.
that is happening, at least 10 to 15 people are there, because this is a requirement for everyone. It's not only for one person.
Yes.
आप वहाँ पे कोशिश करके आप जहाँ पर भी जहाँ जो भी राष्ट्र में हो आप, आपके नजदीक आपके राष्ट्र में जो भी बच्चे हैं उनको एक बार इकट्ठा करें, तो उस दिन हम सर को पूछ सकते हैं, प्लीज एक दिन वहाँ जाइए, असेसमेंट कर लीजिए सबकी कि क्या है जरूरत, बिकॉज दिस इज मोस्ट इम्पॉर्टेंट than BiPAP or than any cardiac assessment. I feel this is a first, because it should be started in the early stages of life, and we are seeing good results. We are seeing so many people. Dr. Sarthak Kamath is an example. Like,
Yes.
that can be done. If it is possible, we will connect it. I forgot your name, Pooja's husband, you mentioned.
Omang. Yeah, I'll do that. Thank you. Yeah, I'll try to
we will share
mobilize
and we
it.
can do that. Thanks
Yeah.
for raising this. I have one more question before Sharda ma'am. Sir, as you are mentioning that you have network in that area also, if you can give the network list, we will upload it on website, and it will be easy for us to connect that area also with your help. That's a small request.
Yeah.
Hello, good afternoon, sir. Thank you for this
Good
very informative and insightful webinar. I just had one question. You talked about hybrid seating, right? So are
Yeah.
you having a hybrid ROHO seating by any chance, or are you developing it in the future? Any plans on that? And also, second question is, are there any ability expos like they have in the US or in Europe and other things? Are you planning to initiate and start? I saw one was there in Kochi last year, but I don't know what was it. So these two questions. I mean, second one is for the general community, and first one I just want to know about the hybrid ROHO seating if you're planning to introduce.
Yeah. ROHO cushion is a particular purposefully made. Yes, is majorly it is for the pressure relief point of view. So based on the child requirement, we design it comes in a different sizes. We can provide in a different sizes. ROHO cushion may not require a lot of modification or adjustment. The size only majorly thing. Okay, because it adapts according to the shape of the bottom of where the child is sitting. It adapts it. The ROHO cushion for other people to understand. It is a air filled like a bubble kind of cushion. That is bubble pops off when you fill in, and when you sit, its shape will get the shape of our bottom. So that's how it's like you're sitting on the floating board. So this cushion is comes in a different sizes, ma'am. It is available, and yes, we can make it bit of customized. Means we don't modify anything. It's not required, but we can size point we can customize this and keep that way.
So because the
Second question.
problem is, sorry. Because the problem is my son has a ROHO, but at the same time, it's not giving him the pelvic tilt that is required for him. Because he still tends to lean on one side after the spinal fusion surgery also. So that is why because I saw in Permobile has come out with some ROHOs has come out with some hybrid ROHO cushions. So I was just thinking if you're also planning something on those lines.
Yeah. I agree with you, ma'am. Row cushion is a not pelvic. It doesn't provide the pelvic stability. So it is a floating cushion. That's what I'm trying to say. Second point I want to say, whether the child really requires this row cushion. Okay, it is one is the costly point of view I'm taking, and the physical point of view. Physical point of view may not require the foam based or the contour based cushions are more useful to stabilize to hold the pelvis well. But the floating cushion actually gives the kind of flotation. So the instability will be higher when providing the flotation one. Yeah, as you're saying, hybrid cushions are combination of gel and foam. And foam is a shaped cushion, and gel you can use it. The second one is gel and foam based cushion you can use hybrid. And for the basic what I design posters I'll show you. The contour cushion is the best one to go for the DMD cases instead of going with the row cushion. Row cushion we go only for the spinal cord injuries who does not have the sensation completely. Otherwise, who require the pelvic stability, I usually recommend to go for the contour cushions or the foam based cushions or gel based cushions. Otherwise,
Okay. And also about the batteries, if you can highlight which are the batteries which you use so that it is approved by the ITA as per the ITA guidelines.
I have limited information about the batteries because a motorized wheelchair technically we don't deal with the batteries in that way. But recently, while I'm getting introduced, I'm trying to unlearn the batteries you take, which is accepted by the flights. No, the flights will allow you to take in because many times you travel. They provide. If you personally contact me, I'll send you those. Those kind of battery solely you take it. It is safety kind of I'm talking, and also how much time of like range one full charge how much range it goes. These two features usually I see before recommending any patient. Otherwise, battery technical I do not have that much information to tell you. But I can, if you contact me, I can recommend some names. I can text you and tell you that one. Yeah. So third, I think second question what you asked before regarding expose, right? Yes, there are
Yes, sir.
in India. In India, there is an association started now, Indian Association of Assistive Technologists, IAAT. Okay, they are conducting in all India, different parts of India. They're conducting these kind of conferences and expos. They're conducting. I think that the Kerala what you heard or attended maybe that IAAT. So that those group only are conducted. So I can connect you with them or whatever conference I get from them. There are details I can send it to you. Or if you save our number, official number, I will also save your official number. When we put it on status, you can get it from us.
Thank you, sir. Thank you so much.
Thank you, ma'am.
Okay, thank you, Sharda ma'am. Raju sir, we have a question in the chat. Sunil Kumar,
Okay.
sir, I am using Mobility India wheelchair since last 7 years. Very good. Thank you. I want to ask a question, sir. Is portable motorized wheelchair available? This is his question in the chat.
Yeah, portable motorized wheelchair available, but only thing is postural support wheelchairs we we need to, that is when it's portable the postural support won't be there, so then he has to be customized. So we need to see compromise whether you want a portable, whether you want a full body support, everything is required. So available, sir, portable. Very just say hi. I can send you the video of it. There's very sleek and slim. So it's like when you fold it, it becomes like a small suitcase size. It will become. Then you easily just put it in this thing. Only thing is, it is again. I'm telling, it's not. You do not decide by seeing the video, by seeing what advertisement is happening. But let us together decide as a parent. I know parent is very important because when you lift up and you are going to do it. And the child physical needs, child should involve. Therapists like me or who is expert in the assistive technology need to come together and decide whether the wheelchair is suitable or not. But it's available, yes.
Sir, I only raise the hand as I
Yeah,
don't
ma'am.
see any raised hands.
Yeah.
We require the same kind of session in Hindi exclusively as
बात
well
कर
as in
सकते हैं
other local
अब
languages, because many of the parents have joined. Yes, they are not, I mean, they
Hindi
understand English, but they can't communicate. Few of them are not able to communicate in English.
ఆ,
Hindi and
బో-
Telugu.
ఆ, ఆ, మా తెలుగులో అడగాలంటే అడగచ్చు, తెలుగులో ఫుల్ సెషన్ తీసుకోవాలంటే తీసుకుంటాను. हिंदी वालों को हिंदी आप लोग अभी पूछ सकते हैं हिंदी में, मैं हिंदी में बात कर सकता हूँ. सरप्राइज मैडम आस्ट सेपरेटली आप हिंदी में सेशन चाहिए तो आई एम रेडी अवेलेबल. इवनिंग टाइम चाहिए, ऐसे संडे में चाहिए, बताइए मैडम को, मैं रेडी हूँ. Mobility India is NGO, non-government organization. It's not a commercial one. Our agenda is the best practices what world is practicing. WHO and guidelines should come to India, and our clients, our service users, our parents, everyone should know about this proper service provision. As there is no law to control the many systems here. As a service users, as a beneficiaries, now we should take it. We should take it forward. So for that, we are available. Please ask any orientation programs like this. I'm available. ఏ లాంగ్వేజ్ అని అడగండి మేడం. తెలుగు, కన్నడ, హిందీ I can take full session. Tamil I understand 90%, speak 50%, but I can understand many clients from your group only. I think that Chennai, not Chennai, nearby Chennai, someone contacted me taking a wheelchair and wheelchair also. So how they take, because we are communicating Tamil, I can communicate. I mean, she can communicate in Tamil, I understand, I communicate in English. So it happens.
Okay.
We can do multi-languages.
Sir, when you were presenting the presentation, आपने ट्रांसफर चेयर में के बारे में एक दिखाया था. आप वो उनको बिठा के आपने वॉशरूम बाथरूम में लेके गए थे. For that particular one, there is a rod in between for this DMD patients, DMD kids, because they can't move the leg like that. That rod is, I mean, isn't it a hindrance? That rod one, the black color rod which you showed.
Yeah, I understand.
That is, if you can go back to that slide, I don't know whether it is 16th or 20. No, just go back to the slide, sir.
Yeah.
Not this one. The earlier video you have shown, na?
Yeah, video. This
right
one.
Side one.
This one.
Yeah. Is it removable or how to manage? Because we can't.
I will tell you.
That's my doubt.
Yeah. Left. Can you see this side? It is the same. This is a
right
manual one. I'm telling you, both are same. Right side and left side. What pictures I'm showing? The two different models. One is manual. The first one is manual. Okay. Can you see my cursor? What is moving?
Yes. We could see the cursor.
This one is manual wheelchair. There is no rod in between. You see. Here, hydraulic one. That's why this T-shaped rod has come. But usually it won't hinder the shifting point of view. But if you do not want this, yes, we have manual one.
If this black rod is removed, then it is manual. If black rod is there, then it's hydraulic.
Hydraulic. Only that hydraulic manual, why I'm saying, this only seat to come up or come down. You want to do manually to lift up, or hydraulic compression you want to use it. That's it. Simple.
Okay. One more question we have in the chat. My son, 10 years, has started walking in tow. Should I start using night splints for him? What precaution to be taken in selecting night splints? Do you provide night splints too?
Yes. Yeah, before answering that, in two models what is shown in the picture here, third one is electric also is there. Electric like a manual and it looks like. There is no T-shape. If you're not able to do manually, you can have an electric one. With a remote, you can press it, your seat goes up and down. Yeah. Yes, night splint also, that A4 should be used as a night splint. One stage. So yes, it has to be, it can be used. And the precaution is the splint has to be provided proper padding. That is called inside the plastic. There is a padding material is there. That is called Ethoflex. The Ethoflex properly used, and the time whenever you are introducing this night splint, it could be 1 hour, 2 hours, 3 hours. Like that, we need to gradually increase the duration of the splinting. Yes, we can use it, and most of the DMD cases use this splint as for majorly night at the early stage. Afterward, they use the daytime also for sitting time.
Thank you.
I hope
sir.
I answered the question.
I think of Alan. For knee buckling, what device is available? I am a deciminopathy patient. I think you can talk to him in Kannada. I think he's from Karnataka.
ಹೌದಾ? ನೀ ಬಕ್ಲಿಂಗ್ ನೋಡ್ಬೇಕಾಗುತ್ತೆ. ಅದು ನೀ ಬಕ್ಲಿಂಗ್ ಯೂಶಲಿ DMD ಅಲ್ಲಿ ನೀ ಬಕ್ಲಿಂಗ್ ಏನ್ ಬ್ರೇಸ್ ಕೊಡಲ್ಲ ನಾವು. ಅದು ವೀಕ್ನೆಸ್ ಇಂದ ಆಗುತ್ತಲ್ವಾ. ಪ್ಲಸ್ ಕನೆಕ್ಟಿವಿಟಿ ಹಿಪ್ ಜಾಯಿಂಟ್ ಅಲ್ಲಿ ವೀಕ್ನೆಸ್ ಇರುತ್ತೆ, ಆಂಕಿಲ್ ಜಾಯಿಂಟ್ ಅಲ್ಲಿ ಇಶ್ಯೂ ಇರುತ್ತೆ. ಓನ್ಲಿ ನೀ ಬಕ್ಲಿಂಗ್ ಅಂದ್ರೆ ಪೋಲಿಯೋ ಅಲ್ಲಿ ಬ್ರೇಸ್ ಸ್ಪ್ಲಿಂಟ್ ಕೊಡ್ತೀವಿ ನಡೆಯಕ್ಕೋಸ್ಕರ. ಬಟ್ ನಿಮ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿ ನೋಡ್ಬಿಟ್ಟು ಹೇಳಕ್ಕಾಗುತ್ತೆ. ಯಾಕಂದ್ರೆ ಡೈರೆಕ್ಟ್ ನಿಮ್ಗೆ ಕೊಡಕ್ ಐ ಕ್ಯಾನಾಟ್ ಟೆಲ್ ಎನಿಥಿಂಗ್ ಹಿಯರ್. ನೀವು ಫಸ್ಟ್ ನಿಮ್ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿ ಹೇಳ್ತೀವಿ. ಸ್ಪ್ಲಿಂಟ್ಸ್ ಆರ್ ಅವೈಲೇಬಲ್ ನೀ ಬಕ್ಲಿಂಗ್. ಬಟ್ DMD ಕೇಸ್ ಅಲ್ಲಿ 99% ಅದು ಕೂಡ ಬೇಕಾಗಿಲ್ಲ, ಕೊಡಬಾರದು. ಯಾಕಂದ್ರೆ ಇಟ್ಸ್ ನಾಟ್ ರಿಕಮೆಂಡೆಡ್ ಅಟ್ ದಿಸ್ ಸ್ಟೇಜ್. ಬಿಕಾಸ್ ಆಫ್ ವೀಕ್ನೆಸ್. ಕೌಂಟರ್ ಸ್ಟ್ರೆಂತ್ ಇರಬೇಕು. ನಾವು ನೀ ಬಕ್ಲಿಂಗ್ ಏನು ಬೇಸ್ ಕೊಟ್ಟಿದ್ರೆ ಹಿಪ್ ಅಲ್ಲಿ ಆಂಕಿಲ್ ಅಲ್ಲಿ ಸ್ಟ್ರೆಂತ್ ಇದ್ರೆ ಮಾತ್ರ ನಿಮ್ಗೆ ನೀ ಬಕ್ಲಿಂಗ್ ಏನನ್ನ ಬ್ರೇಸ್ ಕೊಡಬಹುದು. ಬಟ್ ವಿ ನೀಡ್ ಅಸೆಸ್ ಅಂಡ್ ಟೆಲ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಬೇಕಾಗುತ್ತಾ ಬೇಕಾಗಲ್ಲ ಅಂತ.
Yeah, Murali, you have raised a hand. Any questions there in the physical meeting? Please go ahead. Sir is able to talk in Telugu now.
Yeah, ma'am. No, it is not a specific one. It is to their common. As a Mobility India is also a NGO, and also happy
Yeah,
to know that they have done project at some of the places at Tumkur and Anantapur and other places. We wish to
Yes.
know that how you can be also to helpful some of our muscular dystrophy patients, including in our project for the eligible candidates, sir.
Good. Thank you so much for that question. Yes, yeah, that is what I want to tell. Yes, Mobility India Hyderabad or Mobility India Bangalore. The project what we have adapted some particular areas like Bangalore, around 27 slums we adapted, and we have Chamarajanagar district in Karnataka and Tumkur district. We adapted those areas. For that, we have raised the fund and we are providing service provision there. That is for physiotherapy services, assistive technologies, orthosis, wheelchair, artificial, any kind of clients, we are doing the service provision there. But Mobility in Hyderabad or other part of other than these project areas, we are ready to provide our services. We are available. Technical people are available. Like we can do assessment. Just now, as someone Delhi, that someone said, we can come and help you doing assessments. But we do not have funds for this at this moment. Now funds whatever funds మేము రేజ్ చేసినామో అది ప్రాజెక్ట్స్ మాత్రమే. కానీ మేము అవుట్ ఆఫ్ ది ప్రాజెక్ట్ ఏరియాలో సేవ చేసేందుకు రెడీగా ఉన్నాము. కాకపోతే that the cost expenses for this need to be taken care by the organizations. Like మా ప్రొఫెషనల్స్ ఉన్నారు, అందరు ప్రొఫెషనల్స్ WHO లెవెల్లో ట్రైన్ అయిన ఉన్నారు. WHO అంటాం, లేకుంటే ISPO ట్రైన్ అంటాం, ఇంటర్నేషనల్ సొసైటీ ఆఫ్ ప్రోస్థెటిక్స్ అండ్ ఆర్థోటిక్స్. ఆర్థోసిస్ ప్రోసిస్ తయారు చేసే వాళ్ళు దానిలో ట్రైన్ అయిన వాళ్ళు ఉన్నాం. సో దాని ద్వారా మేము ఒక టీమ్ గా వచ్చి అక్కడ ఒక పర్టికులర్ ఏరియాలో అసెస్మెంట్ చేసి ప్రిస్క్రిప్షన్ చేసి మీకు బడ్జెట్ ఎంత అవుతుందో చెప్పి తర్వాత డివైస్ అండ్ మ్యానుఫ్యాక్చరింగ్ తీసుకొచ్చి మీకు సప్లై చేయడము అంతా చేయగలుగుతాం.
Let us identify, the underprivileged sector of the society. Then let us have a plan, sir, so that we can help this one with your expertise. It will be helpful to the muscular dystrophy patients. Thank you,
Yes,
sir.
that's welcome, sir.
सैयद शाम, आपने आपका हाथ उठाया था, बात कर लीजिए.
जी हेलो सर.
हेलो
जी, मुझे एली टाइट होते जा रहा है सर, इसके लिए क्या करना चाहिए?
फिर से पूछिए, सुने नहीं दिया.
एली मेरा टाइट हो रहा है सर.
क्या हो रहा है? बैक
एली जो है ना पैर का टाइट होते जा रहा है.
एडी बैक
एडी
हील एडी बैक हो रहा है, ऊपर हो रहा है
जी.
टाइट हो रहा है ना. आप
जी.
कितना उम्र है?
25 साल.
आपको जल्दी यूज प्लास्टिक शू यूज कर रहे हैं क्या पाँव को?
नहीं सर, यूज करते थे, उससे कोई फायदा नहीं.
वही उसको वो यूज करो तो मेंटेन होता है. फिजियोथेरेपी प्लस AF यूज करना है ताकि वो स्लो डाउन करेगा, नहीं तो छोड़ दिए तो फिर जल्दी से ऊपर उठ जाएगा. अभी रेस्टिंग टाइम में, सोने के टाइम में, खड़ा होने के टाइम में प्लास्टिक AF यूज करना ही पड़ेगा आपको.
खड़ा नहीं हो पाता.
फिर अभी जैसे भी हो, अभी सिचुएशन आपको देखा नहीं है ना. अब खड़ा नहीं हो सके तो एटलीस्ट बैठ के करिए, बैठ के यूज करिए, नहीं तो लेटने के टाइम में लगाइए उसको. मगर वो लगा के रखना ताकि वो मस्जिद को अच्छा स्ट्रेच करके पकड़ेगा.
जी.
हाँ, सो जरूर यूज करना चाहिए. आप ऐसे सोचना मत. अब ऐसे वो ट्रीटमेंट नहीं है ना, वो प्रिवेंशन है. नहीं तो जल्दी से जल्दी आपको टाइट होता रहेगा. वो मेंटेन
जी
कर रखेगा, एटलीस्ट वो पकड़ के रखेगा।
फुल
फिर
बेस्ट
फिर
सर। सर क्या नाम,
जी,
क्या नाम है इसका सर?
ये अब प्रेजेंटेशन में दिखाया था ना, मैं दिखाता हूँ, AF बोलते हैं। पिक्चर दिखाता हूँ एक बार। देख रहे हैं पिक्चर?
जी
ऐसा वाला। अब AD का टाइट हो जाए तो ये यही है, मगर अब कुछ और प्रॉब्लम देखना पड़ेगा। मगर वो AD टाइट हो रहा है बोलो तो रेगुलरली DMD केस में ये स्प्रिंट देते हैं हम।
जी ठीक है।
जी जी। आप कहाँ से हैं?
गया बिहार।
बिहार से, ठीक है। उधर बनाने वाला नहीं है तो पूछो, हम कांटेक्ट दे देंगे उधर का कोई है तो। ठीक है जी।
जी ठीक है।
ठीक, नंबर नोट डाउन करके हाय बोलिए आप।
शारदा मैम,
Yeah, I just had one more question, Mr. Raju. That you talked. You didn't mention about that hand splints. Is that helpful for people who are getting contractures in, say, in the
Yes.
wrist or in the fingers or something?
Yes, if someone hand is going to only staying in one particular position, yes, we need to provide some time in a stretched position. We have to keep it in a stretched position. Says hand splints are also useful. That need to be assessed. If they're photo or video call, if you make me, then I can see and say this. But yes, orthotics of upper limb also useful in case of any tightness. Some I've seen some day in case of the elbow is getting tighter, so we provide splint to keep it straight, turnbuckle splint. And I've seen some people having a hand also getting tighten up. Yes, orthotics also is required for any contraction, anything tightness developing. Joint is staying only one particular position, gradually is deforming that. So opposite direction of force we need to provide. That is called splinting. Yes, ma'am.
I don't
Thank you,
find,
sir.
I don't see any hands raised. Sharda ma'am, I think.
Yeah, I just had one more question.
Yes, please go ahead.
Yeah, and regarding this, hand splints, you said. So, anything else is there, like you're planning on robotic arms or something, sir, in the future?
There is robotic hand is available for the stroke case. Robotic hand, which is it is a kind of passive exercise tool. Robotic hand is nothing but the passive exercise tool. If it is physiotherapist or you yourself you're not able to do, or you're getting tired, or therapist getting tired, or you want more effective, longer duration therapy, you can do that for the hand is available. But all entire arm is presently is not available. But anything comes like that, we will see.
Are you planning to do any studies on that? Because I've seen robotic arms attached to the wheelchair, which help in grooming, like they can brush their teeth, they can giving more independence. So those sort of any clinical studies or anything you're planning or something like that in the future?
Yeah, presently we are not doing, but we are tied up with for artificial hand. We are doing this a study. Presently we are doing with a breathing control hand, artificial hand. Someone's amputation. We are doing with IIT Chennai and other organizations. We are doing it, but not in the robotic hand point of what you are saying. That in that angle we not tried. But we are doing in a processes side doing, and wheelchair side we are doing, because these are the basic and faster requirement. If the technology yet to come to India, and we need a we don't have bio engineers with us. We need a engineers from the IIT Chennai, IIT Mumbai. We worked. Some one person from IIT Delhi also people come and work with us. So we can work with the people, but we have a clinical expertise, and we have service user to try and test it and tell. But anyone is coming forward like that, we are open to do that.
Thank you. Thank you.
Great.
Yeah.
We have Bhishma. आप बात कर सकते हो सर, आपने हाथ उठाया था।
जी मैम। सर मैं ये पूछना चाहता हूँ, आपने स्पेक सिटिंग का कोई सुना है नाम? कंपनी है न्यूजीलैंड की।
नहीं, नाम फिर से बोलिए।
स्पेक्स सिटिंग कुशन वगैरह बनाते हैं, बैकरेस्ट वगैरह कस्टमाइज। तो वैसी कोई कंपनी इंडिया में है कस्टमाइज बनाती हो जो सर? क्या उनके प्रोडक्ट की कोटेशन ली गई है, पर वो कॉस्टली है बहुत अपने इंडिया के हिसाब से, 4-5 लाख रुपए के बता रहे हैं।
वही ऐसा मैन्युफैक्चर का, वही मेरा प्रेजेंटेशन में बोला, कस्टमाइज्ड प्रोडक्ट्स तो कॉस्टली हो जाता है, एंड दैट आल्सो वी आर गेटिंग फ्रॉम फॉरेन, वो बहुत कॉस्टली हो जाता है। आपका नीड देख के कितना वक्त तक चाहिए उतना ही ले लिया। आप टेक्नोलॉजी तो है, बट देखना है कितना चाहिए उतना ही लगाने के लिए बोल रहा हूँ मैं। बट आपका चाहे तो आपके बच्चों का असेसमेंट करने की हेल्प करता हूँ, प्लीज, और डिवाइस देखता हूँ, उतना टेक्नोलॉजी चाहिए नहीं चाहिए देखना है बस, उतना खर्च लगाना है क्या नहीं करना। कितने
स्कोलियोसिस हो
इंडिया
गया,
में
थोड़ा काफी ज्यादा हो गया है।
काफी ज्यादा हो गया, ठीक है, आप हम इंडिविजुअल बात कर सकते हैं, वो कंपनी का डिटेल मुझे भेजो, पिक्चर भेजो वीडियो का, मैं
जी
देखता
जी
हूँ, फिर
जी
आपका
जी
बच्चे को थोड़ा ऑनलाइन असेसमेंट करके उतना तक जरूरत नहीं है मैं बता देता हूँ आपको,
जी जी सर। सर
है ना?
आपका नंबर कौन सा है? मैं कंफ्यूज हो रहा हूँ,
We
मतलब
will
ये जो
share it in the group, sir. After the
ओके
call, we will be sharing all the
ओके
details in the
ओके
group of sir.
ओके
आपका बेटा
ओके।
CMD से है नहीं तो DMD से है?
डीएमडी,
DMD,
ड्यूशेन मस्कुलर।
ठीक है,
हाँ
ठीक है,
हेलो
ठीक है।
हेलो सर।
हेलो,
हाँ सुनील जी,
Right.
sir, 1 minute,
मैडम।
Sunil ji, 1
ओके
minute. Their hands
ओके
raised. We will give the hand raised and I will give you. Okay, 1 minute.
ओके
Anand.
ओके।
Next one is Anand.
I think you can unmute, sir, unmute, you have to unmute
Sorry.
before talking.
Anand from Hyderabad or North India? From where?
No, he's not unmuted.
Anand has raised the hand. You can unmute and speak. You
Ah.
can unmute and speak. Yeah, please
Yes,
go ahead.
Rama madam, I am Anand KJ from Bangalore.
Yes, sir, please go ahead.
Yeah, Raju sir,
Namaskar, sir.
I want advice regarding those who work. Actually, I work from home, sitting long hours.
Okay.
Usually from morning to evening I used to work, but nowadays from few months I'm getting lot of back pain and hip pain. So
Okay.
how to manage such pains? Any suggestions from you, sir?
Yeah. You yourself with the muscular dystrophy?
Yeah, LGMD. I am a LGMD.
LGM.
He's an engineer, Raju garu.
Okay.
Qualified
Namaste.
doctorate, mechanical engineer, if I'm not wrong.
Yes,
Anand,
yes. Yes, madam. Yes, right.
Namaskar, sir.
Yes,
Bangalore,
recently I got awarded with PhD.
Wow, super. Congratulations.
12 years I worked as a lecturer in engineering college actually.
Okay.
you people
Yeah,
should
because
tie
of this
up,
progression I could not able
Raju
to
sir,
continue.
Anand, all of you, because you are into some expertise
Yes.
and come up with some products for India.
Yeah.
Yes.
But I will contact Raju sir later.
Okay. I'm about to talk
I
that.
have noted down the
Yeah.
number.
Yeah. First thing is, yes, sir. Anyone sitting, not only with the muscular dystrophy, anyone sitting long duration and working. Software engineers are working nowadays. So whoever is sitting and working desktop jobs, they will get neck pain, shoulder pain, shoulder, hand, and back pain is very common. The common advice for everyone, what we do, keep changing your position. So this is a formula for everyone. For you to, you have to specialize, specifically we need to know customized exercise or customized remedies we need to tell you. Whatever chair you're using, if you're not getting up or not able to move side, you can think about taking a chair or whichever as a tilting space. Sometimes you can sit in a tilting space, sometimes in a come to upright position, sometimes recline. So I'm just giving, you cannot stand up and change quickly immediately, right?
Yeah. I
Yeah.
cannot.
So yeah, you cannot start. So for that, what you can take a chair, which is I think one of the picture also showing. I will just go there. I'll just show quickly example of. Can you see a wheelchair here, middle down?
Yes.
So something like that wheelchair. If you're using a wheelchair or if you're using a sofa, not sofa, I will not say, but a chair, regular chair also you can use without wheels if you are using. But this chair also
Reclining, you are telling.
now you can use a chair which has a tilting space, not recline. I'm talking. Okay, tilting space. Can you see the seat also raises up? Seat. My hand. Can you see my hand?
Yeah. Raised like
Like this. So the back rest also go. Sometimes you sit in this position. Sometimes you sit in this position. You don't sit upright. Okay. There is an option of changing your positions in between. So keep changing your position. One thing you can keep it in mind. Yes, if you sit any or whatever it is, you'll get a back pain and this thing. You have a physiotherapy managements available, like using home remedies like heart palpitations, using. If you're too much pain, physiotherapy treatment you can take it. Some exercise you can do it, and also you whenever you're out of the work position, there are pressure relieving positions are there. So pressure relief positions, you try to sleep in that position or try to position your positions that when I'm talking when you're not working. So there are
Yes.
many things we can personalize some advices like that you can think about.
Mhm.
If you near to JP Nagar, Bangalore, so you
Yeah,
can
I
meet
visited
Mobility.
last year. I visited Mobility India here in JP Nagar.
Yeah.
Yeah,
Yes. So you
for
can
the visual
ask.
assessment, something I tried some assisting device. It was not much suitable to me. Same something. So in charge was I think Manoj sir. Manoj, yeah, yeah. I tried it. I visited
Riaz.
Mobility India last year.
Riaz.
Manoj, I think his name was.
Manoj, no one is there. Is Varun is there?
I
Arun or
didn't
Riaz is there?
exactly remember his name. Maybe Manoj.
Yeah. Yeah. Okay. So, but you can, yeah, you can think about meeting them for physiotherapy session. I'm talking if you have back pain or nearby anyone, if you are getting a frequent pains, you can have a physiotherapy treatment, and frequent change of positions is very important.
Yeah, that I do. In between, I'm nowadays taking rest, not sitting continuously.
Yeah.
But I asked about any particular like supportive to back or a sitting hip back sitting supports.
Presently, where you are sitting, by the way?
Pressure relieving supports like what we use in car, no, like that.
Okay.
Pressure.
But have you seen a wheel? The cushion what we use in middle top? Have you seen in Mobility India this cushion? They introduced to you?
Yeah.
There is a for contour cushion is available. Use the contour cushion.
Contour. Okay.
Contour cushion may be useful than the whatever seat, car seat kind of.
Okay.
If you want, I can send the picture of it. It is available in Bangalore also. Just experience first before buying. Just experience it, and how you feel. If you like it, you can check. It's very simple. I'm not talking about Romo cushion, which is costly and maintenance difficult. But here is a simple foam contour cushion will be a nice remedy for you.
Okay.
Yeah. You try that, sir.
I will just be in contact with you and whatever.
Sure.
Yeah, we
Thank
have
you. Thank you.
Sunilji, are you on the line?
Madam, thank you for
Please.
giving my time. Actually, my question is that I am using Mobility India products since the last 4 or 5 years. My son is now doing BTech Computer Science 3rd year. Hello,
Nice.
sir.
Nice.
But sir, my question is, I purchased a step climbing wheelchair, but not from through the RIA, sir. But it is not a Mobility India product. I purchased from the other company. Hello. But sir, actually now it is not users friendly. So I want to, can I get another users friendly step climbing wheelchair? That is my first question.
Okay.
And the second question, actually I want to some specially made bed for sleeping. That is it possible? Specially made bed.
Okay.
My third question is it he can stand even without support or with the support of the wall or something. But I want to stay standing wheelchair. But one of my doctor at the Baptist Hospital, Vinitha madam, told me that the usage of the standing wheelchair for the DMD kit is not advisable. So, but I want. Can I get the customized or suitable standing wheelchair for my son? Another question, what I in mind is already asked by Anand sir. I am thankful Anand sir, and I got the answers. But these 3 questions are mine.
Okay. I'll start from the last one. The standing wheelchair. The standing wheelchair, even regarding a standing wheelchair, I'm talking now. You're able to hear me? Yeah.
Okay, I am hearing, sir. I am hearing.
Yeah, standing wheelchair usually, even I also recommend may not require for this DMD person. One is the standing wheelchair comes with a big frame. It's not a small frame. You cannot use in smaller places. Okay, and I can recommend instead of standing wheelchair, you can use a simple standing device enough for you. Use a postal support wheelchair for him and the standing device separately.
Okay.
But your intention is good that you want to make him stand up, which is very good. But don't include that inside the wheelchair.
Sir, why I asked the question is actually he's going to regular college, sir. His college time is 9:30 to 4:30, and
Okay.
but so he has to be sit in the 9:30 to 12:30. So if there is a standing provision is available, he can stand some time. That is why I asked about the standing wheelchair.
What's his age?
He's 20, sir.
20. What is the type of muscular dystrophy?
Duchenne Muscular Dystrophy.
DMD.
Remaji, know my son condition very well.
Okay. Now this wheelchair particularly you are going to use in the college? Or
Yes,
you want to use in the home also?
No. Actually, it is a customized wheelchair. Even he can 90% lay in that wheelchair, but it is not comfortable. But so I put a bed in the college. So I lifted him the wheelchair and put in the bed for 1 hour. Then after he started to sit in the wheelchair. The college using wheelchair is a customized wheelchair. I think it is the Riyas are done very marvelous job for me, my son. I'm actually the one person, one of the person who are behind for my son's studies is the Riyas sir.
Yes. So that's what in mobility. What we do, customization we do is gives a comfort and this thing. Particularly, you want to make it stand up. Okay, you want to use a standing wheelchair. It comes with a bigger frame. Bigger frame wheelchair. If it is a space like college or workplace with bigger places there, you can use it for standing purpose. I'm not saying it's a contraindicated. I'm saying practically usage of it. First, you try and see if it is really helpful. And the biggest like mobility is how big place it is, spacious, no? Like that work environment, they can use it.
Okay, sir. Thank you.
The comfort wheelchair, what we already taken for mobility, now you can use it in home. But if you're taking another wheelchair for standing, you can use it in the college. Like that, you can use it. But only thing practical, one wheelchair for everywhere you cannot use it because a bigger frame comes. That's why.
So okay, sir. Okay, I have to purchase separately.
Yeah, that's what I'm saying. When you say purchase, then money involved in that. Cost, those are point I'm talking. Otherwise, standing is possible. For them, you can use it. But only technically, I mean, practically using it in all the places, the standing wheels is difficult.
Okay, thank you, sir.
Yeah, okay. The first, I think first question.
Sunilji, if you are done, we will ask Sharda ma'am. Sharda ma'am's question will be the last one because it's been almost 2 hours. Mr. Raju is with us. Sharda ma'am, please go ahead.
Ma'am, before that, I think he asked 3 questions. 1 question I answered.
I'm sorry. Yes, please.
Yeah. The first question I think he asked about the stair climber. Yeah, stair climber equipment. If it is not suitable, you need to identify what all these. I know it is stair climber does not provide any postural support, and using that stair climber for a muscular dystrophy may be difficult without any modifications, without adding any strapping system or cushion system. The standing stair climber only for stairs on the stairs to use it, and you cannot use much for the regular mobility. You need to speak to your work provider technically what is the issue you have with it, and any solutions within it you need to check with them. What was the second question, sir?
So hello, sir. Second question about the bed. About the bed, customized bed.
Customized bed. You speak to Riyas in Bangalore. You can come out with a solution. It is possible. It is available. You can have it. Yes.
Thank you, sir. Thank you so much. Thank you.
Thank you. Sharada madam.
Yeah. So there are 2 questions that I have. One is that we get often queries from parents asking about the braces to prevent scoliosis. They say the spine braces, is it really effective? Because the muscles weaken from internal, and can they hold up the spine? That is one thing. And for tilt table and all this, if contractures set in, can children use it?
Yeah. First question, ma'am. Scoliosis need to be prevented first, not directly, not by using a brace. First, we need to prevent with the proper seating. That's what I want to say. Wheelchair, no. Many parents are taking big wheelchair, thinking for next 5 years. The wheelchair has to be compact wheelchair, small wheelchair. Are they exactly stuck fitting? Okay, you should not take a bigger leg shirt. Some children will take shirt, loose shirt, where after 2 years, 3 years useful. That we may take as a wheelchair also. You should not take loose wheelchairs or loose big products. The exactly compact wheelchairs we need to take, number 1. If you take, that gives a proper posture. And the proper postural wheelchair, postural seating only prevent the scoliosis. Then once start developing scoliosis, yes, we need to, while sitting long duration, we need to provide a sitting device, a sitting brace or sitting scoliosis base, we need to provide, yes, to prevent it. Yes, ma'am, we need to do that. What was the last question, ma'am? Second question, what you asked? Standing frame or tilt table can be used for when the contracture developed. Yeah, if it too much to contraction, minimum degree like 5 degrees, 10 degrees, we need to see knee how much contracture is there. But proper splinting we need to provide, and proper accommodation we need to provide before standing. A tilt table can be used, but based on the degree of severity of contractures, we need to decide. But still table can be used and adjusted as per the deformity levels. Done, ma'am.
I don't see any hands raised. Your hand is raised, Mr. Raju.
Hi.
Mine, how?
Yeah.
I did not go out. Sorry. Okay.
Any other questions? I think if we will send your details in the groups, your contact details and all. And if anyone is inquiring about you, we can share the details. We will be uploading this in parts. First, your presentation will be uploaded in the YouTube. Then later on, we'll upload the questions because it's a huge recording. It's been almost 1 hour. Thank you so much. Patiently, you have answered all the questions. Yes, there are many questions, and we would be happy if you join us for any physical camps in any part of the country as well in respective languages. In Telugu, very shortly, we will be having one more session. I'll get in touch with you later on this. Thank you so much. I know it is very long pending. From 1 year, we have been trying for this. Finally, it happened. Thanks a ton.
Yes, thank you, ma'am.
Thank you so much.
Thank you, sir.
Yeah.
Thank you everyone, and for organizing this, and I think making me to introduce to everyone. Thank you so much.
Great. We will share all the details, and whatever is a PDF you mentioned that is very informative, we'll connect later on that, and we'll put it on the website also. Thank you so much all for joining on this Sunday. Thanks for your questions. Thank you, Raju Garu. Thanks a lot. Take care. Bye, all of you.
Thank you, Rama.
Bye.
Thank you, ma'am.
No, it's an opportunity to talk about Raju. Thank you so much.
We met Raju Garu because of you only. You have given the contact. Then later on, I went for my son's wheelchair. The customization happened. And in Telugu group, especially whenever I'm talking, I'll mention about Raju Garu's wheelchair